Good evening, everyone. Hi, I'm Dr. Jaydevi, LSME, Sigma Medical Coding Academy. Welcome for today's webinar on ICD 10 CM 2026 updates. We are excited. I'm excited to walk you through the journey of these changes, latest changes, and how they impact the changes is going to impact your coding practice. And let's dive in and get into these codes first. So I'll share the PPT with you. Hope everyone can see the slide. If you can see, please put a thumbs up. Is it visible? Yeah, thank you. Thank you so much. So we are moving on to the ICD 10 CM updates 2023. So the learning objectives here is first is to identify and interpret the key ICD 10 CM 2026 code changes, and the second one is to update the official coding guidelines. So reviewing the newly added, revised, and deleted codes with an emphasis on the clinical relevance. Review revisions and clarifications in ICD 10 CM 2026 guidelines that impact diagnosis selection, sequencing, and reporting. ഇവിടെ രണ്ട് കാര്യങ്ങളാണ് നമ്മൾ നോക്കുന്നത്. പുതിയതായിട്ട് ആഡ് ചെയ്യപ്പെട്ടതും റിവൈസ് ചെയ്യപ്പെട്ടതും ഡിലീറ്റഡ് ആയിട്ടുള്ള കോഡ്സും പിന്നെ വന്നിരിക്കുന്ന ഇതെങ്ങനെയാണ് ഈ കോഡിംഗ് ഗൈഡ് ലൈൻസിനെ എഫക്ട് ചെയ്തിരിക്കുന്നത്. Going on to it. The key ICD. I'm sorry, just a second. Is my voice clear to you? Is my voice clear?
Yes, ma'am.
Yes. Okay.
Yes, ma'am.
Okay, fine. So the key ICD 10 CM 2026 code changes, it's actually maintained by the Centers for the Medical and Medicaid Services that has released the fiscal year 2026 updates to ICD 10 CM code classification. So the fiscal period, as you know, is October 1, 2025 to September 30, 2026. That's the fiscal year. Fiscal year. That is 2026. New codes added are 614 new codes, deleted codes are 12, and revised codes are 45. This is a change in the code by chapter-wise changes. You can see the chapters as well as the new and revised and deleted codes. That is, you can see here clearly what all new codes, the total 614 new codes. This is manual. ഞങ്ങൾ ഇത് മാനുവലി തന്നെ ആഡ് ചെയ്തെടുത്തിരിക്കുന്ന കോഡ്സിന്റെ ഒരു നമ്പേഴ്സ് ആണ് നമ്മളിപ്പോൾ പ്രസന്റ് ചെയ്യാൻ പോകുന്നത് കേട്ടോ. So new codes is 614, revised is 45, and deleted is 12. And we are going on to the chapter-wise changes now. First chapter, it's certain parasitic and infectious diseases, the first chapter. We're going into the new codes, B88.01 and B88.09. So this is infestation of Demodex mites. The Demodex mites means those are mites which are usually found in the hair follicles of human beings and even the eyelashes, but they are harmless. But if they cause some diseases, their infestation has to be mentioned. That is, with these codes, these are new codes for the infestation by the Demodex mites, that is the B88.01. Another code for the Ascariasis, B88.09. This is used for non-Demodex mites infestations. Now, the fiscal year 2026, ICD 10 CM does not introduce any new HIV coding rule. Of course, you know the rules regarding B20 and Z21 usage, but this more clarity has been brought into this. There is no rule change, of course. The clear language specifies that the clarity regarding the use of B24, a patient once had this level, even though in the subsequent visits have no active symptoms, they are supposed to use B20 only. ഒരു പ്രാവശ്യം B20 എന്നൊരു സ്റ്റേജിലേക്ക് ആക്റ്റീവ് സ്റ്റേജിലേക്ക് ഒരു പേഷ്യന്റിന്റെ റെക്കോർഡ് നമ്മളെ നയിച്ചിട്ടുണ്ടെങ്കിൽ വി ഹാവ് ഗിവൺ എ B20 കോഡ് ടു ദാറ്റ് പേഷ്യന്റ് ഈവൻ ഇൻ ദ സബ്സിക്വന്റ് വിസിറ്റ് ബാക്കിയുള്ള വിസിറ്റുകളിൽ ആ പേഷ്യന്റ് ആക്റ്റീവ് സ്റ്റേറ്റിലല്ല ഇൻആക്റ്റീവ് സ്റ്റേറ്റിലാണ് പ്രസന്റ് ചെയ്താൽ പോലും വി കനോട്ട് യൂസ് Z21 we have to use B20 only once it has been used എപ്പോഴെങ്കിലും യൂസ് ചെയ്തിട്ടുണ്ടെങ്കിൽ you can use only B20 throughout. That's a clarification given here. Stronger emphasis on the correct B20 that Z21 use has been emphasized here. Moving on to the chapter 2, neoplasm. Neoplasm, it's a new category code fiscal year 2026. We can see the new code added is a malignant inflammatory neoplasm of breast. See, there is many conditions where the neoplasm of breast is developing into inflammatory condition, but this is not actually inflammatory condition of the neoplasm. It is actually the malignant inflammatory neoplasm. So you can use these C50.A082A9. All these are inflammatory carcinomas. That is the laterality specific, that is right, left, and unspecified breast. Now these are when documented, the clearly state when the doctor documents inflammatory carcinoma. You cannot use a carcinoma with inflammation you cannot use this code for that. But if it is specifically mentioned that is inflammatory carcinoma, you can use this code. Do not assign based on the breast inflammation alone without confirmed malignant diagnosis. I hope this is clear to you. Now this is chapter 3, disease of blood and blood forming organs. This is leukocyte adhesion deficiency. It's a rare inherited immunodeficiency disease in which white blood cells are unable to properly adhere to the vascular endothelium and migrate to the site of infection due to defects in the adhesion mode. This results in the recurrent infections and impaired inflammatory response. നിങ്ങൾക്കറിയാം leukocytes ആണ് നമ്മുടെ first defense mechanism നമ്മുടെ ബോഡിയിൽ. That has to reach the vascular endothelium, the region where the infection or the inflammation sets in. That has to be reached there. But due to this deficiency, leukocytes are unable to reach that region. So recurrent infections and inflammation occurs. So this is a condition which has the APC has given ICD-10 CM new code has been come D71.1, D71.8, D71.9, specifically for the leukocyte adhesion deficiency, other functional disorders of polymorphonuclear, polymorphonuclear neutrophils. That's a part, that's a granulocyte of leukocyte among leukocytes. Then functional disorders of polymorphonuclear neutrophils and specified. Yeah, you can use this D71.1 only when LAD, that is leukocyte adhesion deficiency, is specifically documented. And D71.8 for other specified, and D71.9 when the documentation lacks any specificity. Now moving on to the chapter 4. It's endocrine, nutritional, metabolic, and diseases, type 2 diabetes mellitus. Now the new code remission codes, that is diabetes 2, the diabetes mellitus, type 2 diabetes mellitus. If it is in the remission state, what do you mean by remission? Remission means the absence of symptoms, but still the remains of the disease is there. Disease symptoms എല്ലാം ഒന്ന് subside ചെയ്തിരിക്കും, പക്ഷെ disease continue in the state. That is the remission state of a disease. That's the opposite of relapse. Okay, so E11.A, type 2 diabetes mellitus without complication in remission, used when type 2 diabetes is documented as being in remission. Indicates no current complications or clinical remission status. So this code cannot be given with the type 2 diabetes mellitus. That is actual type 2 diabetes mellitus with complications or without complications. It's in the excludes 1 division. Excludes 1 can never be coded with the primary code. So E11.A is the only the provider is coded only when the provider explicitly documents in remission. Do not assume remission based upon the normal glucose or A1C values alone. So it must be documented clearly and precisely to be used. Now moving on to other endocrine disorders like hyperoxaluria. This is expanded now as a primary hyperoxaluria and secondary hyperoxaluria. So these are rare inherited metabolic disorders causing excess oxalate production. So these are the codes for primary oxaluria. E72C, this category, E72.530, 538, and 539. This includes oxalosis and oxaluria. Oxalosis is the condition in which the uric acid is in excess in your body, in the circulating blood, while oxaluria is a condition in which there is excretion of oxalic acid in the urine. Now, this cannot be given along with this secondary hyperoxaluria that you're going to deal with now. Secondary hyperoxaluria. So I've already told you this oxaluria is expanded as primary and secondary. Now the code for the secondary hyperoxaluria results from dietary, intestinal, or other secondary causes. The main code is E72 category, which is subcategorized as 0.540, 541, 548, and 549 for dietary, enteric, and other secondary as well as secondary hyperoxaluria unspecified respectively. So E83, yet another endocrine disorder, the other disorder of mineral metabolism. Fiscal year 2026 are new and expanded. They have been expanded as new and expanded codes are there. E83.81, it's hungry bone syndrome. See, this usually occurs after the removal of parathyroid. What is function of parathyroid? It's a balancing of the calcium content in the blood. But if there is the absence of this parathyroid hormone, what happens? Bone starts taking up all the calcium from the blood. So this calcium gets deposited in the bone instead of the considerable amount in the blood. I mean, it gets deposited in the bone instead of in the blood, and the blood lacks even the basic amount of calcium, which causes calcium deficiency in the blood, and then muscle tetany, other spasmodic conditions, all these musculoskeletal conditions occur. So that condition is known as hungry bone syndrome. The new code is adopted, added to it, E83.81. This condition can lead to hypocalcemia, hypophosphatemia, hypomagnesemia. Going on, E83.89 is other disorders of mineral metabolism used when mineral metabolism disorder is specified but does not have any specific, no specificity is mentioned. You can give for E83.89. That is, most specific code is not available, then you can use this 83.89. And E83.82 for disorders of pyrophosphate metabolism, generalized arterial calcification of infancy. There are different types there. We are going to deal with that. E83.820, that is severe and rare condition characterized by arterial calcification in infancy. So here you must note that if heart failure or other secondary hypertension is documented, you have to compulsorily add that if it is mentioned in the record. So second. Okay, so this is generalized arterial calcification of infancy, GICI. GICI is a rare condition, as I've told you. It's the arterial calcification in infancy. Now, this is a ENPP1 deficiency caused generalized arterial calcification. New code is the 83.821 of infancy. ENPP1 is a genetic disorder, that's a gene associated with the arterial functioning, but there is calcification occurring in the infant because of the deficiency of gene ENPP1. Genetically confirmed ENPP1 related GACI. Here also you must remember that code also. If the record has documented, if the patient's record documents heart failure or other secondary hypertension, you have to add these codes separately. I50 series and also I15.8. That is according to the record, that is record of the patient. Yeah, and yet another deficiency that causes this autosomal recessive condition, E83.822, ENPP1 deficiency causing autosomal recessive hypophosphatemic rickets. Type 2. It's also a rare inherited condition, a phosphate wasting disorder. ഇതെല്ലാം ഓരോരോ ജീനുമായിട്ട് അസോസിയേറ്റഡ് ആയിട്ടുള്ള കണ്ടീഷൻസ് ആണ്. അപ്പൊ ഓരോ ജീൻസിന്റെ കോഡ്സ് ആണ് ഇവിടെ മെൻഷൻ ചെയ്യുന്നത്. ലൈക്ക് ദിസ് വൺ ENPP1, ENPP1 deficiency, ABCC6. These are all gene types. Specific genes ആണ്. അതിൽ വരുന്ന മ്യൂട്ടേഷൻസ് ഒക്കെയാണ് ഈ കണ്ടീഷൻസ് കോസ് ചെയ്യുന്നത്. Okay, ABCC6 deficiency causing generalized arterial calcification of infancy, GACI. You know, GACI is generalized arterial calcification of infancy. You can use the E83.823. Here also, from the previous code itself, I have been telling you that code also, if applicable, heart failure, other secondary hypertension, it applies here also, and also this one. ABCCS deficiency causing generalized arterial calcification. So another one, E83.824, ABCC6, deficiency causing pseudoxanthoma elasticum. This is the connective disorder, connective tissue disorder, you know, skin, which is affecting skin, eye, vascular. That is usually cartilages and other connective tissues are being affected by the deficiency of gene ABCC6. CD73 deficiency causing arterial calcification, E83.825. The CD73, this is a factor deficiency which is caused due to another gene mutation. So this CD73, if deficient, it will cause the arterial calcification. It's also progressive condition. It's a progressive arterial calcification. Now, other metabolic disorders, lipodystrophy, ICD-10-CM code is E88.1. Lipodystrophy, not elsewhere classified. Here, Whipple's disease, as you know, we have studied Whipple disease, that's a pancreatic disease. This is found in excludes 1. So this cannot be coded along with the E88.1 lipodystrophy code. Then specific lipodystrophy code is E88.10. That is the unspecified lipodystrophy. A noise code used only when documentation lacks any specificity. Now, another part, this classification is partial and generalized lipodystrophy. Partial includes all these acquired partial, baracquare, familial partial, and generalized lipodystrophy, E88.12, which includes acquired generalized lipodystrophy, congenital one, Berardinelli-Sape syndrome, and Lawrence syndrome. These are all included codes. Now, E88.13 is localized lipodystrophy, which includes the injection lipodystrophy, insulin-associated lipodystrophy. E88.14 is HIV-associated lipodystrophy. In this condition, you know, you have to go back to the guideline of HIVs. That is, if a condition with HIV-related condition comes, you have to code the active stage of HIV, that is B20, followed by the related condition. Here we have to code B20, human immunodeficiency virus disease first, and use additional code. That is, if adverse effect is documented, you can use the additional code. So here, E88.19, other lipodystrophy, not elsewhere classified. Now, always assign the most specific lipodystrophy code supported by the documentation. E88.10 should be the last resort. That is unspecified code. You should never use it as a hurry. You must go through the chart carefully before going into the unspecified code. Now, if it is HIV-associated lipodystrophy requiring sequencing, which you have to code the B20 code first and followed by E88.14. And of course, you have to check for the drug-induced condition. If it is there, you have to use appropriate T code. I hope this is clear to you, all of you. If you're having any doubts, you can ask me towards the end of the session. Now, the chapter 5, mental, behavioral, and neurodevelopmental disorders. No new ICD-10-CM codes were added for this fiscal year 2026. No additions, deletions. The structure has remained unchanged, and accurate documentation guidelines adherence is there. There's no change here. Chapter 6. In this system, you can see new codes added in multiple sclerosis. This is expanded. So different types we are going to deal with this in this condition. There is relapsing remitting multiple sclerosis, primary progressive multiple sclerosis, active that is, and also secondary progressive multiple sclerosis. Now going back, the ICD-10-CM classification for multiple sclerosis has been expanded to better reflect disease course, activity status, supporting clinical specificity and treatment monitoring. It's G35.A, relapsing remitting multiple sclerosis, RRMS, characterized by clearly defined relapses. What do you mean by relapse? I've already discussed when I said about the remission. So remission is the absence of the symptoms, by relapse എന്ന് പറയുന്നത് എന്താണ്? സിംറ്റംസ് എല്ലാം തിരിച്ചു വരുന്നതാണ് റിലാപ്സ്. റെമിഷൻ എന്ന് പറഞ്ഞാൽ സിംറ്റംസ് എല്ലാം അടങ്ങി പോകുന്ന കണ്ടീഷനാണ് റെമിഷൻ. റിലാപ്സ് ഒരു കണ്ടീഷനാണ്, പീരിയഡ്സ് ഓഫ് റിക്കവറി. റിലാപ്സിംഗ് remitting multiple sclerosis, you can use G35.A, and this is excluded with the demyelinating disease of central nervous system. You can never use this code with this RRMS code. And G35.B, primary progressive multiple sclerosis. This can be again divided as G35.B0, B1, and B2. That is primary progressive MS, active primary progressive MS, and non-active primary progressive MS. So primary progressive MS unspecified, you can zero B0. Point B1 is for active progressive, and B2 is for non-active primary progressive multiple sclerosis. Excuse me. Now, secondary progressive multiple sclerosis, SPMS, here also it is divided as unspecified, active, and non-active. The codes are G35.0, C1, and C2. ഇപ്പൊ ഇതെല്ലാം പുതിയതായിട്ട് ആഡ് ചെയ്തിരിക്കുന്ന കോഡ്സ് ആണ്. മൾട്ടിപ്പിൾ സ്ക്ലെറോസിന് ഇങ്ങനെ ഒരു പ്രിസിഷൻ നേരത്തെ ഇല്ലായിരുന്നു. This has given us more light into these codes, multiple sclerosis codes. Now, this is unspecified code. Multiple sclerosis, unspecified, disseminated multiple sclerosis, generalized multiple sclerosis. ഇങ്ങനെ ഏതെങ്കിലും ഒരു കണ്ടീഷൻ പറയുകയാണെങ്കിൽ you can use this multiple sclerosis unspecified codes, because there is no particularity or specificity regarding any of the type given here. You can give this multiple sclerosis unspecified code. Now the disease causes, RRMS, we have discussed RRMS, PPMS, and SPMS must be clearly documented for selecting this code. And also you have to check for the activity status, whether it is active state or non-active state. We have discussed this earlier. That is the active state or non-active state. This division is given here in the primary and the secondary. And avoid G35.D, that is unspecified code. If any of this progression or activity is mentioned, you have to go for that. Avoid if it is mentioned, if any of this type or activity is mentioned. Now, disease of eye and adnexa, it's inflammation of eyelid. This is also expanded specifically. The like other specified inflammation of eyelid. Here also, if the Demodex mites infestation is mentioned, you can add that separately. You have to give them separately. The code has to be given again. Now, here it is the laterality and also the regarding the right eye, left eye, unspecified eyelid, or upper and lower eyelid, both. All these laterality and specificity is clearly mentioned in these codes. So right eye for 01.81, 82, 83, and 8A. Left eye 84, 85, 86, and 8B. So unspecified eye 801.89, other specified inflammation of unspecified eye. And 801.9 is unspecified inflammation. Okay, inflammation of eyelid, not otherwise specified. Use only when laterality and eyelid details are not documented. If any of the details is mentioned, you have to go for this one. Now, key coding notes, ICD-10-CM now supports a precise laterality and eyelid involvement. Use 801.8 series when inflammation is specified but not classified elsewhere. Always add beat 88.01 when Demodex infestation is documented, that we have discussed. If there is Demodex infestation documented, you have to code them separately. And avoid H01.9 when clinical detail, any of the clinical detail is available, just avoid. അങ്ങനെ എന്തെങ്കിലും ഒരു ഡീറ്റെയിൽ ഉണ്ടെങ്കിൽ ഒരിക്കലും H01.9 യൂസ് ചെയ്യാതിരിക്കാൻ നോക്കുക. So going on to the chapter 8, there is no change at all. Chapter 8 changes ഒന്നും document ചെയ്തിട്ടില്ല. No new revised or deleted codes. Existing codes are structured and this documentation and code selection is accurate. Now, 9th chapter, circulatory system. There's a new code, I-27 category, that is other pulmonary heart diseases. This is Fontan-related circulation. See, Fontan-related circulation is actually, this is a circulation that is giving a direct link between the heart and lung. So this is a surgery that is done for congenital heart disease. When the baby is having congenital heart diseases, the direct flow of blood from heart to the ventricles to the lung is established. Such circulation is called Fontan-related circulation. So if there is any complications or physiological conditions related to Fontan circulation, you can use this code I-27.84. The specific codes for these I-27.840, that is Fontan-associated liver disease. I-27.841 for Fontan-associated lymphatic dysfunction. Here also you have to check whether the chylothorax, Fontan-associated protein losing, or plastic bronchitis is mentioned or not. If they are mentioned, you have to code them separately along with the primary code. I-27.848 is other Fontan-associated condition. Here also you have to code additionally the specific Fontan-associated condition. Now, I-27.849 is Fontan-related circulation unspecified. Excuse me. Now, other specified pulmonary heart diseases, conditions specified but not elsewhere classified, is I-27.89. They use Fontan-specific codes only when the Fontan circulation is documented. And also, you have to check for any code also, use additional code instructions given in the underneath that code. Avoid any unspecified codes when Fontan-associated condition is clearly identified. Now, this chapter 9 expands Fontan-related circulation coding to capture long-term systemic complications with greater clinical precision. ഇതിനകത്ത് ഈ Fontan-related കണ്ടീഷൻസിനുള്ള പുതിയ കോഡ്സ് ആണ്, വളരെ ഇമ്പോർട്ടന്റ് ആണ്. കൺജനൈറ്റൽ ഹാർട്ട് ഡിസീസിൽ സർജറിക്ക് ശേഷം എസ്റ്റാബ്ലിഷ് ചെയ്യുന്ന സർക്കുലേഷന്റെ കോംപ്ലിക്കേഷൻസ് ആയിട്ട് വരുന്ന കണ്ടീഷൻസ് ആണ് ഇതൊക്കെ. Chapter 10 and 11, respiratory and digestive system, there's no changes introduced. No new revised or deleted code. Existing code structures are unchanged, and there is accurate documentation guidelines added. Moving on to the chapter 12. Okay, new ICD 10 CM codes FY, that is fiscal year 2026. Here, a new codes. See, there was no actual codes for flank specific infection. Most of the codes, you can see this flank specific infection codes. So L02.2 in the category, a different flank conditions. Flank, you know the word flank is. It's a part between the, it's a sides. Abdominal part, sides in flanks. L02.217 is for cutaneous abscess of the flank. These codes are very useful. Pain, abscess lower abdomen, upper abdomen, middle abdomen, unspecific conditions. But now there's for specific code for flank. Any disease condition, flanks in the code adopted. Now this L02.217 is cutaneous abscess of flank. L02.227 is pharyngeal of flank. L03.31A is cellulitis of trunk. L03.32A is acute lymphangitis of a flank. Now, we search for the pressure ulcers, that is ulcer, underneath we go for the pressure ulcers, and for the non-pressure ulcers, we just go for the site underneath the ulcers. Now you have non-pressure chronic ulcer codes for trunk and face. See, this is expanded, clearly expanded as underneath that is non-pressure chronic ulcers for abdomen. You can see L98 point, that is L98 category for abdomen, specifically for the sides, for the chest. You can see for the chest, for neck, different codes are there. Now for the face, for the groin, specifically given for this side, non-specific, non-pressure ulcers. Upper limb, the upper limb non-pressure chronic ulcers. So here, it excludes one. You can see gangrene, pressure ulcers, skin infections, lower limb ulcers, varicose ulcers. ഈ കോഴ്സ് ഒന്നും ഒരിക്കലും ഈ അപ്പർ ലിംബ് നോൺ പ്രഷർ ക്രോണിക് അൾസേഴ്സിന്റെ കൂടെ കൊടുക്കാൻ പാടില്ലാത്ത കോഴ്സ് ആണ്. ഓക്കെ, നോൺ പ്രഷർ ക്രോണിക് അൾസേഴ്സിന്റെ കൂടെ ഒരിക്കലും കൊടുക്കാൻ പാടില്ലാത്ത കോഴ്സ് ആണ്. അതുപോലെ തന്നെ ഇതിന്റെ 7th ക്യാരക്ടർ ഭയങ്കര സ്പെസിഫിക് ആണ്. യു കൻ സി 7th ക്യാരക്ടർ ഉണ്ടോ? നമ്മള് ടാബുലർ ലിസ്റ്റിൽ വരുമ്പോഴാണ് 7th ക്യാരക്ടറിന്റെ സ്പെസിഫിസിറ്റിയെ കുറിച്ച് നമുക്ക് കൂടുതൽ എന്താ പറയുന്നത്, വി ബിക്കം അവെയർ അല്ലെ. അപ്പോൾ ഇങ്ങനെ ഈ 7th ക്യാരക്ടർ, ഫസ്റ്റ് വൺ സ്കിൻ ബ്രേക്ക് ഡൗൺ ആണെങ്കിൽ യു ക്യാൻ യൂസ് 1, ഫാറ്റ് ലെയർ എക്സ്പോസ്ഡ് ആണെങ്കിൽ യു ക്യാൻ യൂസ് 2, necrosis of muscles 3, necrosis of bone you can use 4, muscle involvement without necrosis you can use 5, bone involvement without necrosis 6, other specified severity 8 and unspecified severity 9. ഈ 7th ക്യാരക്ടർ ഉപയോഗിക്കുമ്പോൾ നിങ്ങൾ ഇതിനകത്തുള്ളത് ക്ലിയർലി നിങ്ങൾ ആ ഡോക്യുമെന്റിൽ നിന്നും കൃത്യമായിട്ട് അനലൈസ് ചെയ്തെടുത്തിട്ട് വേണം ഈ 7th ക്യാരക്ടർ. ഈ 7th ക്യാരക്ടർ യു നോ ഹൗ ഇമ്പോർട്ടന്റ് ഇറ്റ് ഇസ് while taking the ICD course. If there is any change in the 7th character, the code itself goes wrong. So these are upper arm axilla codes, the same L98 series, L98 category codes. A11 for right upper arm, A12 for left upper arm, A19 unspecified upper arm, forearm. Forearm you have L98, A21, A22 and A29, and hand A31, A32 and A39. Now here you have to remember these are all non-pressure ulcers and you can never use L18. You know, L18 is for pressure ulcer, right? So here the site and depth must be documented. You have to avoid unspecified severity whenever possible. And pressure and non-pressure ulcer distinction is high audit risk area. So be careful while coding this. Pressure and non-pressure ulcers are a very important codes and is frequently under the risk of auditing. Moving on to chapter 13. Disease of musculoskeletal and connective tissue. This is a new code M05.A, abnormal rheumatoid factor and anti-citrullinated protein antibody with the rheumatoid factor. So this identifies the serological positivity of rheumatoid factor and anti-CCP in patients with rheumatoid arthritis. So supports improved clinical specificity, disease characterization and risk assessment. In this condition, you have to code for the rheumatoid arthritis with rheumatoid factor by site. That is M05 to 002, M05.8A, you have to code that first. And additionally, you can report this M05.A, that is abnormal rheumatoid factor and anti-citrullinated protein antibody with rheumatoid arthritis. So, this additional code ആയിട്ട് കൊടുക്കേണ്ട ഒരു കോഡാണ് വന്നിരിക്കുന്നത്. അപ്പോൾ ഫസ്റ്റ് നിങ്ങൾ റുമറ്റോയ്ഡ് ആർത്രൈറ്റിസ് വിത്ത് റുമറ്റോയ്ഡ് ഫാക്ടർ എന്ന കോഡ് സെലക്ട് ചെയ്തെടുക്കുക. അതിനുശേഷം രണ്ടാമത് അഡീഷണലി M05.A എന്നത് അഡീഷണലി റിപ്പോർട്ട് ചെയ്യുക. No, use M05A only when abnormal RF or anti-CCP antibodies are documented. അങ്ങനെ ഡോക്യുമെന്റ് ചെയ്തിട്ടുണ്ടെങ്കിൽ മാത്രമാണ് നിങ്ങൾക്ക് അഡീഷണൽ കോഡ് കൊടുക്കാൻ പാടുള്ളൂ. Always sequence the site-specific rheumatoid arthritis code first. Remember to use the site-specific code first and then use this M05A as additional code. Do not use M05 without confirmed diagnosis of rheumatoid arthritis. Going on to Chapter 14, disease of genitourinary system. So immune complex mediated glomerulonephritis. It's a new code. Okay, the new codes distinguish idiopathic with secondary immune complex disease. So here it is divided as idiopathic and secondary. and that clearly separate them from the C3 glomerulonephritis. So idiopathic, secondary immune complex mediated glomerulonephritis, and C3 glomerulopathy is the new course that has been added. Let's see what all these are. Acute nephritic syndrome, here excludes one is acute nephritic syndrome with C3 glomerulopathy. And N00.B is acute nephritic syndrome with immune complex membranoproliferative glomerulonephritis, ICMPGN. B1 and B2 is the idiopathic and secondary. The codes are separately given. It's expanded. Here also you can see the nephrotic syndrome with immune complex membranoproliferative glomerulonephritis. Here also the codes are expanded as N04.B1 for idiopathic and B2 for secondary immune complex MPGN. Now, hereditary nephropathy, APOL1, that is apolipoprotein, that is mediated kidney disease. And O7, that is 07.B hereditary nephropathy, not elsewhere classified with APOL1 mediated kidney disease, AMKD, that is, it includes glomerulonephritis and with glomerulosclerosis. So it's a genetic condition affecting the kidney's function linked to variants of APOL1. That is the apolipoprotein 1. The chapters 15 and 16, no new additions. There are numerous codes here. You need not have any new additions. Of course, there is no new addition. Existing course remains unchanged, and emphasis on accurate documentation and guidelines compliance is given here. Just a second. Excuse me. Now, chapter 15 and 16, as I've told, no additions and existing codes are unchanged, and no documentation. That's accurate documentation guidelines compliance has been emphasized. Now, chapter 17, congenital malformation, deformities, and chromosomal abnormalities, new ICD 10 codes. You can see the new disease condition added is Q99.2 fragile X chromosome syndrome. So it's actually an intellectual disability syndrome that's genetically associated. And Usher syndrome, that is Q99.8, other specified chromosomal abnormality, which include Usher syndrome, 0.81. The Usher syndrome is also a congenital defect. See, here what happens is that the patient have congenitally this vulnerability for these blindness, deafness, and even pressure, the balance problems. So these are common conditions associated with Usher syndrome. So here you have to use additional code to identify associated manifestations such as auditory disorders or visual disorders. You have to mention, if it's mentioned clearly, you have to code them additionally with this Usher syndrome code Q99.81. Now, specific types you can see Usher syndrome type 1, 2, and 3. Other specified and unspecified code is there. Now, other specified chromosomal abnormalities, you can give Q99.89, and chromosomal abnormality unspecified directly going to Q99.9. Moving on to neurodevelopmental disorders related to genetic variant QA0 category, neurodevelopmental disorders related to specific genetic pathogenic variants. Here also you have to check for attention deficit hyperactivity disorder, ADHD, autism-related disorders, and developmental epileptic encephalopathy, epilepsy, intellectual disabilities, and pervasive developmental disorders. If mentioned, you have to code them separately. Ion channel gene-related disorders QA0.010, neurodevelopmental disorders related to pathogenic variants in ion channel gene. That is related neurodevelopment disorders. We have many codes QA 0.01, 0101, 0102, and 0109, and you have to check for the specific condition to take these codes. Now, receptor gene related disorder, also you can have QA 0.011 and 012 based on the glutamate receptor gene related disorder or other receptor gene related disorder. Now, transporter solute carrier gene disorder, yet another one, that is QA 0.013, 1 and 0139 for SLCS A1 related disorder and other transporter solute carrier gene disorder. These are all neurodevelopmental disorders. Synapse-related gene disorder, QA 0.014, synapse-related gene disorders. The three types are mentioned here. Transcription and gene expression disorders, QA 0.015, Fox-Given syndrome, and other transcription gene expression gene-related diseases or disorders. QA 0.8, other neurodevelopment disorders related to other specific genes. Now, chapter 80. Here you're going to deal with many codes, that is symptoms, signs, abnormal, and clinical laboratory findings. New ICD 10 code, the abdominal tenderness. See, there was no actually code for tenderness. You know what is tenderness? It's a pain that is generated only while palpation or pressure is introduced. That's tenderness. That's different, entirely different from the common pain. So R10.85, abdominal pain of multiple sites, is excluded with abdominal rigidity that is not otherwise specified, generalized abdominal pain with acute abdomen, non-specified, and localized abdominal pain. Now there is tenderness given, I've told you, from there Planck codes have been added. The site code Planck is added. R10.8A is flank tenderness, 8A1 is right, 8A2 is left, 8A3 is suprapubic tenderness, 8A9 is flank tenderness, unspecified. So different flank tenderness codes have been adopted. They are added. Now moving on to R10.A, it's pain localized to flank. Includes lateral flank pain, lattice region pain. That is, it refers to flank only. Here excludes to. If that is pain localized to other parts of the lower abdomen or upper abdomen is mentioned, you can use it along with R10.A. In subcategory codes, flank pain, unspecified side, flank pain right side, flank pain left side, flank pain bilateral, unspecified abdominal pain. Subcategory codes. Now, cannabis-related gastrointestinal condition, condition R11.16, cannabis hyperemesis syndrome, cannabinoid hyperemesis syndrome. You can code cannabis abuse or dependence or use if mentioned. You can give the separate code. Also, if the manifestation like dehydration or electrolyte imbalance is given in the chart or the record, you can use that code separately along with this cannabis-related gastrointestinal, that is hyperemesis syndrome. Now, costovertebral angle tenderness. Here also tenderness code is adopted. Costovertebral region, angle tenderness, that's also side-specific. Right side, left side, bilateral, unspecified side. Separate codes are there. Now, abnormal immunological finding R76.81. Abnormal rheumatoid factor anti-CCP without rheumatoid arthritis includes abnormal anti-CCP, abnormal anti-cyclic citrulinated protein antibody with RF. Excludes rheumatoid arthritis with rheumatoid factor. R76.89 are the specified abnormal immunological findings in serum. This is included with the raised immunoglobulin levels, unspecified. Now, 19. Injury, poisoning, and certain other consequences. A lot of codes have been added. S30 is superficial injury of the abdomen, lower back, pelvis, and external genitals. Here excludes one superficial injury. Hip in the superficial injury excluded. I never code it with this one. It is specifically for the abdomen, lower back, pelvis, and external genital. Hip code is separately there. So never code them with that. Now, the seventh character, as you know, A for initial encounter, D for subsequent encounter, and then S for the sequel. You already know that. You have to keep that in mind while taking these codes. S30.0 is contusion of lower back and pelvis, which includes the contusion of buttocks. S30.1 is contusion of abdominal wall and contusion of groin and flank, respectively. Now, S31 is open wounds of abdomen. Here also, this flank specific code is there. Lower back, pelvis, and external genitals. There's a flank specific. Without penetration, this wound would not penetrate into the peritoneal cavity. This must be open wound, but not penetrating. An unspecified open wound of abdominal wall, S31.106. Here also it's a side specific, laterality specific. Right flank, left flank, unspecified quadrant, and unspecified flank. You have the code, separate code for specific code for them. Similarly, laceration without foreign body of abdominal wall, right flank, left flank, unspecified quadrant, and unspecified flank. S31 category codes are there. Puncture wounds without foreign body of the abdominal wall. Here also the flank codes are there, the site specific, unspecified, and unspecified quadrant also is there. Now moving on to poisoning and certain other consequences of external causes. It's mostly on fluoroquinolone antibiotic related events. The poisoning by adverse effect and underdosing of fluoroquinolone antibiotics. So T36.AX is the category, that subcategories AX1, AX2, AX3, AX4, and AX5 and AX6, depending upon whether it is accidental, intentional, assault, undetermined, adverse effect, or underdosing. So you must have the support from the intent and adverse effect. Of course, you must know that what is the intent and adverse effect. Now, the toxic effect of xylaxine, you have another code T65.85. That is one is accidental, T65.841 is accidental, 842 is intentional, and 843 is assault. Here also you can use the additional code to identify the manifestations. Like cellulitis, non-pressure chronic ulcer, or other non-pressure chronic ulcers or pressure chronic, non-pressure chronic. And the effects of the external causes. Now, other specified effects of the external causes. There's abnormal gravitation force, weightlessness, war theaters, Gulf War illnesses was given here clearly. Gulf War illnesses, T75.830 and 838 is effect of other war theaters. So T75.8 is other specified effects of external causes. Now, new codes for this milk and dairy products are, of course, we were searching for this, right? Food-related anaphylaxis. T78.070 is anaphylactic reaction. Anaphylactic is an abnormal, unpleasant reaction, right? It's very violent reaction due to milk and dairy with tolerance to the baked milk. And T78.071 anaphylactic reaction due to milk and dairy with reactivity to baked milk. T78.079 anaphylactic reaction due to milk and dairy unspecified and other foods. Anaphylactic reaction due to the other food conditions. Foods. T78.09. Now, adverse effects, food reactions, non-anaphylactic reactions, milk and dairy products. You can see T78.110 to baked milk, their tolerance and reactivity to baked milk, T78.111. Other adverse food reaction, T78.11. Yet another is a precise code for the egg reactions also, egg. T78.120, other adverse food reaction due to egg with tolerance to baked egg, then with reactivity to the baked egg. In chapter 20, external cause of morbidity, you can see foreign bodies and object entry events. W44, foreign body entering into or through the natural orifice. Other sharp objects entering into or through a natural orifice. W44.8, other foreign body entering into through a natural orifice. 45 is foreign body or other entering through skin. So previous one was natural orifice. Now this is the foreign body entering through the skin, nail entering through the skin, fishing hook entering through the skin, other foreign bodies entering through the skin. Now, blast overpressure events, war operations. You have Y36.A, blast overpressure in war operations. Here you have to code this accidental detonation or explosion of grenade or explosion of torpedo or improvised explosive device. If mentioned, you have to code them additionally. And subcategories, you can go for Y36.A1 and A2. Blast overpressure in war operation, A1 is it's a low level blast and A2 is high level blast. Now, military operations. Nowadays, wars are very frequent, right? And there's no reason for these wars also. So, military operations, Y37.A, blast overpressure in military operations. You have to code also the type of explosives, if known, that like accidental detonation, explosion of a grenade, or if it's an explosion of torpedo, improvised explosive devices. You have to find out what is the cost for this explosion and you can add them separately. You have to code them separately. Here also Y37.A, they have two subcategories, A1 and A2, A1 for the low level blast and A2 for the high level blast. Now, activities codes also animal and outdoor activities, Y93.K9 involving animal care and Y93.L other outdoor activities, that is L1 for activity of splitting of wood, L9 for activity of other outdoor activities. So these are the new codes introduced. Moving on to the chapter 21, the codes factor influencing health status and contact with the health service. Genetic susceptibility to malignant neoplasm. See, this is the like a status that the patient can have this malignant neoplasm because of the genetic susceptibility. So regarding the digestive system, you can add Z15.06, that is 060 for colorectal cancer, 068 for other digestive cancers. It's a malignant neoplasm of urinary tract. The patient is having a genetic susceptibility. Another status code is Z15.07 and 09. Now, prophylactic surgery. Prophylactic surgery is to prevent any cancerous condition, not surgery for a cancer. You have seen encounter for different surgery codes are there. But here, encounter for this prophylactic surgery, Z40 has been introduced. Z40.81 encounter for prophylactic removal of ovary with a genetic familial risk of cancer. If a patient's family is having a ovarian cancer family history, then the patient is prone to have maybe at the risk of getting this cancer. So in order to prevent that, if the ovary is removed, you can use that 40.81 and 82. Similarly, for the removal of fallopian tubes with or without the non-genetic familial risk factors, and 89, that 40.89 encounter for other prophylactic surgery. Now, financial and social determinants of health is at 59. Financial insecurity. You might have seen certain persons undergoing this accident. This suicidal cases, you can see maybe the causes financial insecurities. So these can be used as external cost codes. So that 59.861, financial insecurity, difficulty paying for utilities, that is used as additional, this external cost, this the status code. This excludes inadequate housing facilities it cannot be used along with the inadequate housing utilities. Now, is that 59.868? Other specified financial insecurity, bankruptcy. It's a state of bankruptcy you can use. Is that 59.868? And 869 for financial insecurity, unspecified. Now, exposure to war theater and hazardous environment is at 77. It's exposure to Gulf War theater, other war theater, and exposure hazardous to other contacts. That's 77.31, 39, and 9 respectively. If the family history of cancer is there, is at 80.44. Family history of malignant neoplasm of fallopian tubes is a specific code given. Now, food allergy status also has been introduced, like milk product allergy is there. You can use that's 91.0110, 0111, and 112 based on the allergy to milk products with tolerance or reactivity. Now, again, the status code for allergy to eggs, newly added, unspecified. With tolerance or reactivity, they have separate codes. Other personal risk factors, you can use is at 91. B, that is DES, diethylstilbestrol, that's a contraceptive pills. So that's all regarding ICD 10CM 2026 update. I hope that's clear to you and useful to you. I'm very happy and I'm grateful to all of you for joining this session. And I would also request you to give a small testimony on how you benefited from this session, if you have gained any knowledge or if it was successful or you understood what I've tried to explain to you. Would you please give me your suggestions? You're open to suggestions. Thank you so much.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you so much.
Thank you, ma'am. Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am.
Ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Hello, ma'am.
Yes. Yes, dear. Who is that?
Yes, ma'am. Ma'am, will this PDF be shared?
This PDF cannot be shared because this recorded session will be available in the YouTube.
Oh, okay, ma'am. Okay, thank you.
Thank you. Anupama,
Yes, ma'am.
can you have you been benefited from this session?
Yeah, ma'am. Yes. Thank you so
Can
much. It was
you,
really useful. Yeah.
Yeah, thank you very much. But I would suggest you if you could give me a testimony that if you can on the video, if you are comfortable, and tell how you felt like my session was.
Okay.
Thank you very much.
Ma'am, should I on the video now?
Can you please?
Yeah, okay. Ma'am, am I visible?
Yeah, you're visible. Thank you.
Okay, ma'am. The session was really helpful. And, it gave us a lot of information regarding the updates, which is made in this 2026 year. Yeah, thank you, ma'am. It was really helpful.
Thank you very much, Anupama. Thank you very much.
Yeah, ma'am, and I have
Anybody
a doubt,
else?
ma'am.
Yeah, you can.
Yeah, so for the 2026 CPC exam, so we'll have to follow these guidelines, right?
Yeah, guidelines will be applicable only after a certain period of time. Actually, it won't come at a glance or at a stretch. Mean that you'll have time for that. Of course, this
Okay.
has to be accepted slowly.
Okay, ma'am. Okay. Thank you so much.
Thanks. So, anybody else who would give me a testimonial? Okay, thank you so much.